to talk about lymphatic drainage and association. Lymphatic drainage follows a specific predictable pattern critical for cancer spread. Like you have a breast, that lateral breast draining into the axillary nodes, skin above the umbilicus draining into the axillary nodes, skin below the umbilicus draining into the superficial inguinal nodes, gonads like testes and ovaries in the para-aortic, with some of the major exception as well, abdominal organs in the celiac, superior mesenteric, inferior mesenteric nodes as per their arterial supply. So lymph drainage is basically following the arterial supply. And it basically predicts the specific pattern for cancer metastasis. It predicts either skin that drains into the superficial nodes, whereas the organs drains into the deep nodes. And clinically, it predicts that where the cancer is going to, or infection is going to spread. So let's talk about the different lymphatic drainage and the associated pathology. We have submandibular and submental. This is submandibular and submental nodes draining the oral cavity, anterior tongue, and the lower lip by the submental. Submandibular and submental nodes are draining oral cavity, interior tongue, and lower lip, associated with mets of oral cavity. Deep cervical, draining head, neck, oropharynx, and involved in upper respiratory tract infection, infectious mononucleosis, Kawasaki disease, malignancy of head and neck, and oropharynx. Supraclavicular, right side into the right hemithorax, left via Werco node into the left hemithorax, abdomen, and pelvis. It is linked with the malignancy of thorax, abdomen, and pelvis. Mediastinal is draining trachea and esophagus. It is linked with the pulmonary TB, which drains into the unilateral hilar sarcoidosis, bilateral hilar lung cancer, and granulomatosis disease. Hilar is also for the lungs. Axillary nodes. Upper limb, breast, and skin above the umbilicus is upper limb. Axillary nodes, mastitis and metastasis, especially breast cancer in the axillary nodes. Epitrochlear is involved for hand and arm, and the associated pathology is secondary syphilis. So secondary syphilis basically involves epitrochlear nodes. Celiac for liver, stomach, spleen, pancreas, upper duodenum, superior mesenteric, lower duodenum, jejunum, ileum, colon, splenic flexure, inferior mesenteric colon from splenic flexure to upper rectum. These are involved with mesenteric lymphadenitis, inflammatory bowel disease, and celiac disease. Periumbilical or sister Mary Joseph for the advanced CA gastric cancer. It drains abdomen and the pelvis. And para-aortic for testes, pair of testes, ovaries, kidneys, fallopian tube, and fundus of the uterus. External iliac for the body of the uterus, for the cervix, and the superior bladder. Internal iliac for the cervix, proximal vagina, corpus cavernosum, prostate, inferior bladder, lower rectum to anal canal above the pectinate line, and superficial inguinal for the distal vagina, vulva, scrotum, urethra, anal canal below the pectinate line. Internal iliac for above the pectinate line, superficial inguinal below the pectinate line, and skin below the umbilicus except the popliteal area. Skin above the umbilicus was axillary, and skin below the umbilicus is superficial inguinal. Associated pathology with the external iliac, internal iliac, and superficial inguinal is sexually transmitted infection, medial foot, leg cellulitis in the superficial inguinal. Popliteal, dorsolateral foot, posterior cuff, and lateral foot and leg cellulitis. Right lymphatic duct in the dog. These the dense one, the colored ones are palpable, and the other ones, hollow ones, are the non-palpables. Right lymphatic duct drains the right side of the body above the diaphragm into the junction of right subclavian and the internal jugular vein, whereas the thoracic duct drains the below the diaphragm, left thorax, upper limb into the junction of left subclavian and internal jugular vein, and rupture of thoracic duct can cause pylothorax. So left side and other all below the diaphragm and is drained into the thoracic duct, whereas right lymphatic duct drains the right side of the body above the diaphragm into the junction, and thoracic duct below the diaphragm, and the left thorax and the upper limb into the junction of left subclavian and internal jugular. This is all about the lymphatic drainage and associations.